Hi everybody, my name is Peyton Tuttle, and today I will be presenting on mental health and suicide in the veterinary field, and I was advised by Miss Maynard. Okay. So a little about myself. I am originally from McKinney, Texas, and I now live here in Oklahoma, and I have a job lined up in Edmond at Danforth Animal Clinic. I have two cats. The black one's name is Peppercorn, and the obese one's name is Chili Pepper. And then the rest of these pictures are just my friends and family, and the top left is my boyfriend. Before I get into today's topic, I want to discuss a little bit of why I feel that this is such an important thing to talk about. Most mental health situations are a choice and lifestyle problem. This is a comment that was left on my survey by one of our classmates. I have diagnosed clinical depression, and guess what? I sure didn't choose that. I was diagnosed when I was 23 years old, and the percentage of adults that are affected by any symptoms of anxiety and depression is highest among 18 to 29-year-olds. I have lived arguably an incredibly privileged and happy life with amazing and loving parents that have supported me through everything I've ever done, and yet I still have depression. It is a mental illness. It is a disease just like anything else that anyone can have, regardless of choice and lifestyle. So now, to move on to my objectives. First, we're going to talk about terminology, how and why the veterinary field is affected, risk factors, methods of suicide, the OSU class experience, and room for improvement. So these are some of our terms. Mental disorder is characterized by a clinically significant disturbance in an individual's cognition, emotional regulation, and behavior. It is usually associated with distress or impairment in important areas of functioning. Depression is a state of decreased interest or pleasure in almost every daily activity. It affects sleep quality, leading to fatigue or energy loss, excessive weight gain or loss, reduction or gain in appetite, agitation, or psychomotor delay. Anxiety is a mental condition characterized by excessive apprehensiveness about real or perceived threats, typically leading to avoidance behaviors and often to physical symptoms such as increased heart rate and muscle tension. Anxiety disorders include panic, OCD, separation, social anxiety, and generalized anxiety disorders. Burnout is a syndrome characterized by continuous stress, physical and mental exhaustion that develops slowly and leads to energy exhaustion due to specific requests, depersonalization, and lack of professional achievement. And finally, compassion fatigue is deep exhaustion that emerges from exposure to and caring for humans and animals who are suffering. This condition can present with symptoms that emulate anxiety, depression, and post-traumatic stress disorder. In the veterinary field, 1 in 11 early career vets have had significant distress with depression and anxiety. Even more than that, 1 in 6 veterinarians have experienced suicidal ideation since graduating veterinary school. Look around you. That is a tangible number, 1 in 6. Out of our 106 classmates, that is 18 people. Why are vets so affected? When we start our careers, we're moving quickly from the school environment where we're constantly surrounded by our friends and peers to the relative isolation of a private practice. A lot of new practices are 1 to 2 doctor places, with yourself possibly being one of those too, which leads to little supervision, lack of assistance from colleagues, and professional mistakes. There is also a link between euthanasia and habituation and fearlessness regarding death. Similarly to that, veterinarians have a more favorable view of physician-assisted suicide as compared to that of the general population and even common medical practitioner opinion. The suicide rate for companion animal medicine is 2.9 times higher, food animal medicine is 2 times higher, and mixed animal medicine is 1.7 times higher compared to that of the general population. In a study, male veterinarians between the ages of 45 and 64 had a relative risk of suicide that was 5.6 times higher than that of the general population, as well as pharmacists, dentists, and medical practitioners. In that same study, while age wasn't specified, female veterinarians had the highest relative risk of 7.6 times higher compared to that of the general population. 2/3 of suicide attempt survivors have indicated that their attempts were contemplated for less than an hour beforehand, and almost half of them were for less than 10 minutes. I'll be back to why this is significant later on. In that same survey, 66% of veterinarians in Alabama admitted that they have suffered depression, and 24% have considered suicide. However, only 11% of them thought that suicide was a concern. And I believe that this relates to our profession's inability to ask for and discuss needing help.
So some risk factors specifically in veterinary medicine include our personalities, undergrad training, professional isolation, work stressors, psychiatric conditions, access to and knowledge of means, and stigma. Stigma goes back to what I just said about being unable to ask for help. We perceive ourselves as the helpers, and if we are feeling broken, how are we supposed to fulfill that role that we've placed on ourselves? That then leads to feelings of weakness, guilt, and shame. Talking more about personality factors, the big 5 personality traits described by McRae and Costa are extroversion, agreeableness, openness, conscientiousness, and neuroticism. Among veterinary graduates, neuroticism, which is the tendency to focus on continuous negative emotions, is one of the highest predictors of occupational stress. High levels of neuroticism in combination with low levels of conscientiousness, which is defined as being careful, efficient, and organized. Those 2 things combined together can lead to stress, depression, and dysfunctional coping, and those are traits commonly seen amongst our profession. This is just a risk factor pathway chart that illustrates how those factors compound on one another and can possibly lead to suicide. One of the other things I mentioned was our access to and knowledge of means. The most common method of suicide performed in veterinarians was the use of pentobarbital, which is also otherwise known as euthisol. Most of those drugs had been obtained in the workplace. 69% of veterinarians that died via euthisol got that at their jobs. In another survey, veterinarians were asked if they were alone in their clinic and needed access to controlled drugs, could they do so? 71% of respondents said they alone could get those drugs. And I'll get back to that when I talk about future improvements. So now into the survey that I've mentioned. I sent out a 16-question survey to years 1 through 4 about mental health. About 90% of respondents were female and 10% were male, which I feel correlates well to the overall ratio within our classes. In general, the responses were fairly evenly distributed between the classes. 42% of respondents indicated that they had a mental condition prior to vet school, and of those who said yes to that, 64% said that they felt that vet school made their condition worse. Overall, 73% of participants said that vet school was detrimental to their mental health. I asked these questions in order to establish a baseline with which students are entering the grueling profession that is vet school. The last question I asked purposely vague by saying in any way, as I wanted to establish the negative emotions that everybody is feeling, regardless of severity, because difficulty is difficulty, it's not a fight of who is having it worse. We as a profession need to continue to acknowledge that this is a grueling process that does lead to increased negative emotions throughout our students. The next questions I believe show positive improvement. Prior to vet school, 54% of students sought out help if they needed it, while during vet school, 71% of students sought out help. Now, this could be due to what I asked in the previous questions, with more students experiencing negative emotions and therefore seeking out and accessing help. However, this could also be due to improved resources offered to us by the vet school that people may or may not have had prior to vet school. Regardless, this is a positive increase, and hopefully the percentage of people accessing help continues to increase as we continue to talk about this topic. The final question I wanted to discuss is I asked if students felt that they felt comfortable talking to their classmates without being judged. About 53% of students said yes, which I personally found really awesome and honestly a higher percentage than I expected. But the next highest was maybe at 37%. What makes someone a maybe and not a yes? The thought that we are surrounded by people that share that sentiment that I began the opening quote with, that is what makes people a maybe. Worrying that people around you believe that your issues are not real or made up makes it an incredibly isolating experience and makes people not want to share. That is why I stand before you today saying that I have depression, because maybe me saying it out loud will make other people feel comfortable that they can talk about their problems as well. We as a profession have to accept that this is a problem and work towards better improvements. I'm not going to read all these to you because that's a lot, but you can kind of just skim them as I'm talking. These are just some of the comments that were left on my survey by the students 1 through 4. Overall, the general sentiment was the difficulty that students face throughout vet school. That is compounded by depression, anxiety, stress, and the pressures students put on themselves, put on by their classmates, and put on by the school. So how do we improve? At the administrative levels, One of the most common comments I received in my surveys was people desperate for better order and routine, specifically regarding testing. Other medical schools have designated test dates as opposed to the seemingly random schedule that we feel we have. And so I believe that it would be better if we could implement better communication between individual classes to come to a consensus of when best test dates could be, and that would alleviate significant stress. We need to continue to discuss resources that are available to us, whether that's through Ms. Maynard here at the Veterinary School Services or at main campus with other counselors and programs there. I think we too often get locked in the vet school bubble and forget that we are at a major institution that does have other resources available to us. We need to continue to talk. Individuals who communicate better with others about emotional issues have a greater ability to recognize the suffering of others as well as be open and empathetic compared to others who do not discuss. As we move into our careers, we need to form communities because that's what prevents the situations of isolation and loneliness. And great options for that are local Facebook veterinary groups and veterinary medical associations. So other than emotional and social improvement, we have to have medicine-wide improvement as well, and that includes limiting access to lethal means. One of the best ways to implement that is the 4I system, or the two-person system, which we here at OSU have actually already begun with Cubex, which is a system that requires 2 separate fingerprints in order to access a controlled drug. Another option for that is the RFID systems, which require 2 tabs or 2 fobs in order to access those drugs. Every type of lethal means that has been studied has found similar results that when you limit access, you limit suicide risk. When we implement these to our jobs, this is limiting suicide or clinic-associated suicide risk. I know that it may seem really annoying and tedious to have to access something with 2 fingerprints when you just need something really quickly at work, but getting rid of the option of accessing these drugs entirely by yourself is a great change. As I said earlier, 2/3 of suicide attempt survivors contemplated their attempts for less than an hour beforehand. If the thought to then action of performing is such a short spur of the moment thing, having a physical barrier such as Cubex or an RFID system can stop that spiral and allow people to settle down and think better about what they're doing. Something that we can include at the institutional or workplace level is a program called MindStrong, which is a cognitive behavioral skills building program that helps practice turning automatic negative thoughts into positive ones, as well as how to regulate emotions, positively cope with stressors, and problem solve. I feel that this is a really great option because more often than not, when people are experiencing episodes of anxiety and depression, they just need a rope to pull themselves out of that hole that they're in, and these practices can be that rope. In a study using MindStrong at a veterinary institution, students that indicated depression and anxiety and thoughts of self-harm prior to completing this program no longer had those feelings afterwards. This program does require a facilitator, so if this was at your workplace level, that could be someone like your practice manager. They learn the program and then can provide it to participants. This is, of course, a paid program, as most things are, but it does have several efficacious studies that I think is just a really cool option out there. Another option is Lifeboat, provided by Not One More Vet. Not One More Vet is already a great option in terms of finding peer support and resources in the veterinary field, but I found Lifeboat particularly interesting. It is an anonymous mental health support group system where after completing a questionnaire, you are sorted into groups of like-minded individuals with whom you can discuss your problems with. The other individuals in this program are other veterinary professionals, which I feel is a really cool option because these are people that have experienced things that you have been through that those outside the profession may not fully understand. This is a support group and not an immediate crisis line, so that's just something to keep in mind when we think about Not One More Vet and Lifeboat specifically. Key points of suicide prevention in veterinarians include training about tools that bring awareness to suicide risk and incentives for promoting work-life balance. This includes improved organizational skills, which goes back to the conscientiousness that I talked about earlier, implementing easily accessible best practice guidelines for suicide risk detection, intervention, and prevention, promoting a healthy and welcoming work environment, and support. The last one is especially key when you notice those around you struggling. It is important to make them feel heard and reassured while asking pointed questions about changes that have been happening in their life. This can provide someone a window when they have been feeling alone to recognize that there is someone out there that cares and wants to hear from them. These are the common warning signs segmented into 3 topics. Talk being more so about negative emotions, behavior leading towards social removal, isolation, things like that, and mood changes, typically in drastic directions, whether that is someone who is characteristically very outgoing and happy, suddenly becoming more reserved and quiet, or just someone who is naturally more subdued, suddenly becoming really, really aggressively better and happy. That may seem contrary to what you think, oh, they're happy, but that could be an indication of a suicide risk. So in summary, the veterinary field has a mental health problem, with 1 in 11 veterinarians experiencing significant distress with depression and anxiety, and 1 in 6 veterinarians experiencing suicidal ideation. Male veterinarians have the highest relative risk of 5.6 times higher than that of the general population, and female veterinarians have the relative risk of 7.6 times higher. Veterinarians are predisposed due to personality, undergraduate training, professional isolation, work stressors, psychiatric conditions, access to and knowledge of means, and stigma against mental health. The most common method of suicide used is via pentobarbital, otherwise known as euthanol, and is most commonly accessed through your workplace. Improvement in the veterinary field can be through continuing to talk and educate each other about these matters, implementing 2-factor authentication systems to prevent easy access to lethal drugs, and using programs such as MindStrong and Lifeboat. Key points of suicide prevention include improved organizational skills, implementing easily accessible best practice guidelines for suicide risk detection and intervention, and support. These are all my references, and do we have any questions?